you start.
Okay.
But it will.
Okay. Thank you. Thank you. I hope my slides are visible. And
it is visible. It
thank
is
you.
visible.
Thank
You
you.
can
Thank
start
you.
now.
Yes,
All
sir.
right. All right, sir. Thank you. So I'm Dr. Nishant Srivastava from Lucknow. I'm delighted to be here. And I thank IFPH for another session on vitiligo. And I'm grateful to my all mentors, my gurus, Dr. Sahani sir, Dr. Dhanesh sir, and so many my gurus are there presently online. I want to show wonderful cases on vitiligo, which has always inspired me for for research in vitiligo. My there's so much of social stigma attached to vitiligo that people are facing so much of stigma plus social boycott. The thing is that people are actually facing social boycott. Nobody wants to sit next to them. Nobody wants to touch them. And even it's for especially for female girls, the nobody wants to go to their house. Even in villages, I have seen so many cases where these patients who are suffering, they are socially boycotted. And this has all inspired me to start working on dermatology, especially vitiligo. Vitiligo has always been my area of interest, and my PhD is also on this topic. And I just want to prove today and show that what homeopathy can do in vitiligo. So the most important point about vitiligo, I want to tell you, it belongs to an autoimmune disorder category. Okay, the category of the disease is autoimmune disorder. So the best part I want to tell you that in the coming 21st century, right, autoimmune diseases can only be treated by homeopathy. This is I'm saying because I've been working on autoimmune diseases like psoriasis, like vitiligo, like SLE, like rheumatoid arthritis for very long. So I have got wonderful results on this. So I just want to tell you that where other system of medicines fails, homeopathy starts from that very place. So I want to tell everyone, don't limit your challenges, challenge your limits. So autoimmune diseases are difficult to treat. Definitely, we all know vitiligo, psoriasis, it's difficult to treat. SLE, it involves so much of it's all of the systems. But I just want to tell you that also that homeopathy has a great role to play in autoimmune diseases, especially vitiligo, which I want to emphasize today in my presentation. So let's not limit our challenges. Let's challenge our limits. So autoimmune diseases, we all know nobody wants to have it, and it is because of the our disarranged vital force, you can say, or our disarranged immunity. And when our immunity backfires, or the balance is is in disarray, then we get autoimmune disorders where the our cells starts acting against ourselves itself. So the recognition between the cells fails, and when that fails, there is a origin of autoimmune diseases. So first thing I want to tell you, it is a systemic inflammation and attacking its own tissues. This is autoimmune diseases. Just giving you a small background. And first of all, I want to tell you, we need to treat the cause and not the symptoms. Okay, this is very important to understand. The cause of every disease has to be found out. Important thing is we have to understand the emotional angle, or any physical angle, or anything which leads to the start of the disease. That is important to understand and find out. So our immunity, the root cause of our immunity is so many things, right? There is a great balance between everything. Even World Health Organization says that it's mind, physical body, mind, and our spiritual. When these things come into a proper balance, then we have a state of health. That is the state of health. And when this things gets dearranged due to trauma, infections, nutrition deficiencies, emotional stress, then we get autoimmune diseases. So autoimmune diseases can also be caused by genetic factors, environmental factors, and endogenous factors, as it is there in the, you can see the slides. Now, we all know that our stress creates a lot of problems. And for every disease, the origin of all the disease has mostly been attributed to our mind, our stress, our emotional quotient, our emotional distress that leads to a physical disease. Our great Dr. Hahnemann sir has specified in our organon how mind has played such a big role in disorders when the diseases are created. Especially in the modern medicine, people now accept that the importance of psychosomatic disorders. But in our pathy, our great Dr. Hahnemann sir has already emphasized the importance of mind. And when there is body and mind, when it is into a balance, the state of health is there. What happens in the mind is always reflected on the disease, right? Or always reflected on your body. That is to be understood. And body-mind coordination is very important. And we have to understand what is mind and what is brain, right? Brain is an anatomical thing, right? You have different parts of brain, cortex, brainstem, and so many other parts. Cerebral cortex is there, medulla oblongata is there. But the mind is something related with our emotions, like our our ailment factors, anything which affects our grief, our insult, our anger, our shock, misfortune, right? And death of someone, unsuccessful efforts, animals, so many delusions are there, dreams. Mind is made up of so many dreams, delusions, ailments, and mind constitutes the importance of the importance of treatment also in vitiligo. If we know the ailment factor, then our reaching to the minimum constitutional medicine becomes easier. So a case has to be taken properly, and every case taken properly, and higher mental symptoms should also be emphasized, and thus we can reach to a minimum. Now, we all know stress. Stress creates a lot of problems. Stress makes you weak. Stress makes you sick also. And we have a lot of stress related with our, businesses. Our emotional quotient is there, and related to our business, career, health, debts, worried. So many conditions that we are always stressed about. चिंता जो होती है वो चिता होती है. तो चिंता ना करें, चिंतन करें. Find out the solution of the problem instead of just taking stress. And because stress will always create a disease in your body. Now, and stress also is responsible for hormonal imbalance. And as we always know, the psychoneurohormonal axis is there, where all the our psychic symptoms, our mental symptoms affect the hormones, and thus hormones affect our disease parts, certain body parts. Maybe it's skin, maybe it's our kidneys, maybe our gastrointestinal system. So many things. So our hormonal balance has to be there, and stress tries to creates an imbalance, and we should know how to cope up with the stress. So we should manage our time. We should start meditation, yoga, exercise, have a lot of friends. See, everyone has stress. Nobody can say that I am stressful. But the point is, we need to understand how we have to cope up with. So types of emotions are there, how we react to the stress. That is also very important. Stress comes to everyone, and how we react. We should learn how to respond rather than to react, right? We should know how to respond. So our response is important. Appreciation, sympathy, anger, joy, anxiety. These are different types of emotions. Fear, depression, rejection, embarrassment. These are types of emotions are there, which affect our hormonal imbalance, which I was talking about, and talking about psychoneurohormonal axis, how our mind affects our hormones, and how that hormonal axis plays important role in increasing like blood pressure, sugar, and affecting our adrenal glands and pancreas, and thus creating a lot of diseases, right? So every emotion has a lot of hormones which comes into play. Like for love, it's dopamine, serotonin, oxytocin. For happiness, there is dopamine, serotonin, and so many different things are there. So our hormonals, what we say is our chemical imbalance. In Munna Bhai movie, there was a dialogue, the chemical locha that they used to say. It is because of the chemical locha is basically our hormonal imbalance which comes to play. Now we have to understand how stress creates a lot of problems in vitiligo. So today I want to show you the maximum number of cases which I have treated for in vitiligo, and you will just find out. Just want to tell you certain very important things. Treating vitiligo is a real challenge. Why? Because when you take out the repertory, right? I'm talking about the original repertory, Kent repertory, BBCR repertory, Boger repertory. And if you go in the skin part, okay, when you go into the skin section and you just see white discoloration, right? White discoloration, you will find out there are very few medicines. In the newer repertories, like the computer repertories nowadays, you just take a rubric and there are like so many medicines, right? But if you take the original repertories, like Kent repertory, right? Example I'm giving you, discoloration white, only few medicines are there, right? I just wanted to pinpoint something, that why organopathic medicines are not effective in vitiligo. I just want to tell you an example, because in all the repertory, like Kent repertory is in front of you, white discoloration, you can see hardly 10-15 medicines, right? And in the same way, William Boric, you can see white discoloration, very few medicines, only 2 medicines are there, okay? And Boger synoptic key, if there 7 medicines are present. I'm just showing you the original repertory rubrics are having very less medicines which are specific of vitiligo. And why we fail to treat vitiligo, I want to emphasize that. Okay, so I just want to tell you, there is no shortcut to success. There is no shortcut to success. People try to give ASF, people try to give so many medicines. Some people give sepia, natramure, and whatnot. Okay, there is no formula to this. I just want to tell you that in BSK you can see only 7 medicines are there. I'm not talking about the latest computer medicines or latest repertories, because they include all the repertories and every rubric has like thousands of medicines, which is confusing the totality. I'm just telling you our legendary repertories, right? Okay, so I told you about Kent, I told you about BBCR, BSK. Here also still discoloration, you can see very few medicines are there. White, you can see 15 medicines. Apis is there, arsenic, fluoric acid, these are there. Murphy repertory, you can say, right? Very few medicines are there in this Boger-Hossain repertory. Just see, very few medicines are there. So I want to tell you that BBCR, you can see very few medicines are there, right? I'm just telling you that why specific medicines fail to treat vitiligo. That is important to understand. And because of these examples, I'm telling you, as organopathic medicines are very few, according to the repertory itself, right? According to the repertory itself, so it indicates that specific medicines are not of that much of use. That has to be understood. So when specific medicines are not so useful in vitiligo, treating vitiligo, then what options do we have? We have options of constitutional medicines only, right? So I want to tell you, I want to emphasize on everyone that these things show that according to our legendary repertories, only important importance should be given to the constitutional medicine, which can only treat vitiligo. So that is why specific medicines more often than not fail because of this. And just showing you one important, very interesting case of a 2-year-old, 13-year-old female student. You can see a vitiligo on her temples, and below the eyes, you can see, just see such a young female, and she's a distant relative of mine, and she's from Gazipur, and they started my treatment. And when the patient is your relative, your responsibility doubles, okay, and your risk factors also doubles. You can see the condition of the patient, what kind of the patient is in. So just telling you the first case I'm showing you, rubrics of repertorization. These cases are very long cases. In short, I want to show you maximum number of cases so that you can see that people have a very negative feeling that vitiligo cannot be treated. I just want to, in this time allotted to me, I want to show you how much vitiligo can be treated, right? And homeopathy has the best answer for vitiligo. So in this case, rubrics for repertorization: ailment, death of loved one. After the death of grandfather, there was a grief, sentimental, sensitive to music, company aversion to, anger toxin disposed, anger consoled when, dwells on past disagreeable occurrences, memories. This is important to understand. The patient has a grief, long-standing grief, and it has started from the death of grandfather. So she's become very sentimental. She has got company aversion to. She wants to, be alone. She doesn't want to mix. And anger talks and dispose. Whenever she's angry, whenever she's not feeling good, she just keeps quiet. She goes to a corner and sits, okay, and dwells on past disagreeable occurrences. These were important in this case. So repertorization was done in this case, and you can see the personality, sentimental, grief, company aversion to, dwells on past disagreeable occurrences, and natramur was prescribed in this case, because you can see more often than not, the personality of the patient is clear. Natramur 1M was given in this case, and you can see how beautifully the coloration of the has started coming up. So this is the first follow-up. Pigmentation has started appearing on the upper lips, eyelid, and placebo was given 15 days. You can see second follow-up. Picture speaks for itself, and you can see these temple areas have the pigmentation has come up. Only the upper eyelid area is left. So in the third follow-up, you can see both sides that these the white patches have been covered. Pigmentation has started appearing, and the improvement has started taking place. And you can see before and after pics how natramur only can easily cure vitiligo if you know the exact personality of the patient. So you can see before and after photographs of this case, and you can see only this, a small part of this was left in this case, and even now as we speak, even this part is cured. So such a big patch is cured, and temples has been cured. So natramur has worked beautifully in this case, and the patient has improved very well. Now coming to the second important case, a 2-year female, and this is a very important case of very small, a very young female girl child. And when she came to my clinic, her mother started crying. She started crying, and she didn't know, the kid didn't know why my mother is crying. She is continuously looking at her mother. Why is she crying? So when she showed to me, see what is the what has happened to my girl, my child, and you can see the whole of her chest and even on the shoulders white patches were there. And especially in villages, this is considered to be such a big stigma, such a people have a very bad things to say about the family, कि आपका पुराने कर्मों का फल है, और आपने जो है कोई आपके यहाँ आता नहीं है, कोई आपके यहाँ जाता नहीं है. That is what people do, especially in villages I'm talking about. Nobody wants to come to your house, nobody wants to touch you, nobody wants to sit next to you. So these are very difficult times for the people in whom family, in whose family there's a case of a vitiligo. So in this case, you can see this, how this female child is suffering. I would just want to tell you one thing. Just showing photographs of before and after, does not say that vitiligo can be treated, right? In present scenario, the present scientific, present scientific environment, there has to be a particular score. Score has to be there. How much the patient has improved before and after treatment. So in vitiligo, we use a VASI score. VASI, that is Vitiligo Assessment Scoring Index. That is 900 of this case. Okay. And coming to the repertorization part, timidity, bashful, sentimental, consolation, amylate, anxiety, weeps easily, company desire for, affectionate, and desire open air, and thirstless. इसकी माँ कहती थी कि ये तो कभी पानी मांगते ही नहीं है, हमको जबरदस्ती पिलाना पड़ता है. So that was the exact statement of the mother, that she never wants to drink water. We force her to drink water. Okay, that amount of thirstlessness is there. And desire open air. She cannot go to the washroom also. She cannot go to the washroom until the, if the door is locked. She's, she wants to be in the open air. She's very affectionate. She's very emotional. She weeps easily. She always wants to be with someone. Okay. And this picture was taken because the child was very young. We had to take the, the case, whatever the mother and the father, the parents of the child, described her. And according to that the case taking was done. And you can see simple rubrics were taken. See, I want to tell you something. I don't believe in fantasy materia medica, right? I believe in simple rubrics, simple repertorization, and simple medicines, right? And you get good results with it if your case taking is right. So in this case, taking simple rubrics because the child was so young, and you can see repertorization was done, pulsatilla came to be the first medicine. Phosphorus is there, lycopodium is there, but that bashfulness, that consolation, amylate, affectionate, emotional part, thirstless, that leads to the indication that this medicine is of pulsatilla. And you can see first follow-up and subsequently many follow-ups. It's a long case, right? But I have cut it short to show you maximum number of cases in the allotted time, how the patient has improved, how homeopathy has helped these cases of vitiligo. So you can see VASI score from 900, it came to 105. Okay, so VASI is Vitiligo Assessment Scoring Index, right? So even just showing the photographs of before and after will not do. This is a case of my PhD, and you can see pre-VASI score was 900 and post-VASI score was 10. And in the fourth follow-up, it was 105 and it came down to 10. And you can see how beautifully the patient has, improved. We got the smile of the mother back, and she was so happy seeing the case that vitiligo can also be treated. She has taken a lot of allopathic medicines. She has taken a lot of Ayurvedic medicines and so many, जिसको गांव में कहते हैं झाड़ फूक करना, किसी ने कुछ कह दिया, किसी ने कुछ कह दिया. She has tried everything, but after that a simple dose of pulsatilla has improved, and you can see how beautifully the patient has improved. So this is also a very good case. I want to show that how vitiligo has helped. One more case I want to show of vitiligo. You can see neck and upper back. Since 5 years, this female is suffering. Okay, I want to show you maximum number of cases. Just see, white discoloration, neck, upper back, asymptomatic, no itching, nothing. Just white patches on the upper back, behind the ear, leading to the upper back. And you can see simple. I have not done repertorization also in this case. This case was so obvious. It was so obvious. It was not required. I just gave that day. I remember when this case came, there was a lot of rush in the clinic, so I could not take the proper case taking of this case. Right? I generally take every case in a proper way. in proper case taking is done, proper repertorization is done, and then we come to the constitutional medicine. But in this case, they were simple symptoms which I observed and asked her parents and brothers, and dullness, confusion, obstinate, laziness was very important in this case, fearful, coward, right, and excessive sweat on head, excessive desire for eggs, mathematics poor in, and chilling. Simple rubrics I have taken. I have not even done repertorization. It was so clear that you can see simple calcarea carb 30 was given in this case. And dullness, confusion, obstinate, lazy, fearful, cowardness, excessive sweating on the head, desire eggs, mathematics poor in, chilly, very chilly patient, calcarea carb 30 was given. And you can see how beautifully the case has evolved and most of the patches have gone. So very beautifully, this case has improved. So the constitutional medicine is very important. Working up of the each and every case is very important. But sometimes you come across certain cases which are very obvious. You find that this is the constitutional medicine, like natramute. There is sadness, there is introvert, kam bolna, chup rehna, reserve rehna. These symptoms are very common. In the same way, calcarea has its own typical symptoms of laziness, confusion, obstinate, excessive sweating on the head. I want to tell you one more important thing. See, your interpretation of mind and my interpretation of mind can be different, right? For same symptom, you can have your own rubric. I can have my own rubric. Your understanding of the mind will be different. My understanding of the mind will be different. You will take another rubric. I will take another rubric. But one thing is very important. I want to emphasize that, as if in this case, just see, when there is physical general, clear-cut physical general, I want to tell you, like chilly, like desire egg, like sweat excessive head on, that will be the same for you also, for me also. That is a milestone. That cannot be changed. So I want to tell you that importance of physical generals is, it has to be taken in each and every case, because mental interpretation can go wrong for you also, for me also. But the physical symptoms, physical generals will always be the same for you also, for me also. So that will be the guiding symptom. So in this case, so physical generals has to be considered in most of the totality. That is all I want to say. So coming to the next point, you just see this case, a young child and with vitiligo on the foot, 12 years, male student. It's a 2013 case and suffering from very long, since 1 year, okay, and lots of white patches are there on the foot, and ailments from not being loved, delusion, everything will fail, anticipatory anxiety, shy, timidity, fear, failure of, and intelligent. This was the prime symptom of this case, and repertorization was done. Just see, ailments from not being loved, delusion, everything will fail, anticipatory anxiety, मैं कुछ काम करना जा रहा हूं, कर नहीं पा रहा हूं, what will happen next, timidity, fear of failure is important. Although this patient is intelligent, this has to be understood. It's an intelligent child, but lacks confidence, and delusion, everything will fail. Whatever I will do, I will not be successful. This was the delusion in this case, and repertorization was done. Silesia covers, you can see on the repertorization chart, silesia covers most of the medicines, most of the symptoms, most of the rubrics, right? And in this way, silesia was given, and you can see in the first prescription, pigmentation has started coming up, whiteness has reduced. I want to tell you one thing. Vitiligo means milky white color, that is vitiligo. And when this milky white, bright white color reduces, right? When that whiteness reduces, that means you are going in the right direction. So just see the first case, first photograph, and just see this. The white pigmentation, has subdued, has come down, right? Pigmentation, the जिसको कहते हैं ना चमक, सफेदी की चमक वो कम हो गई है. So the pigmentation has improved. And this is the fourth follow-up. See, the area also has come down. And fifth follow-up, you can see every step. I will show you the photograph, every step. And you can see this is the sixth follow-up of this case. And how beautifully the vitiligo has covered. Seventh follow-up, seventh photograph, and before and after, you can see how beautifully homeopathy has worked. So we should understand that getting the right constitutional medicine is important, and there is no shortcut to success. These formula medicines, somebody says ASF, somebody says Amivisnaga, and so on, so forth, Natromure, Sepia, they will help you only till a particular point. But if you want to cure the case, constitutional medicine is important. So coming one more case, young chap, 26-year-old, white patch on the face, and you can see he stopped going to the college because everybody used to, taunt this young guy about the white patch. And you can see how broad it is, how big it is. And rubrics were taken. It started with death of the father. It's a grief, right? It's not an ailment, it's a grief, long-standing grief. Death of father, brooding, loathing of life, forsaken feeling, dwells on past disagreeable occurrences, sun aggravation, desire salty food, the physical general I was talking about. See, the mentals and the physical generals are gelling together very well. They are gelling together. It is showing the personality of the patient on the mental plane also, on the physical plane also. So, reserved, less friends, introverted, cannot share his feelings, negative attitude, and grief, brooding, loathing of life, forsaken feeling, dwells on past disagreeable occurrences, anxiety, anticipation, cannot cry in front of others. Natromure cannot cry in front of others. He always goes to another room, closes the door, does not share his feelings, and there he cries. Pulsatilla cries anywhere and everywhere, right? For seeking the attention. Calcarea carb also, right? In the same way, Natromure was given in this case after repertorization, and you can see how beautifully this is the second follow-up. Pigmentation has started coming up, black spots have started coming back, repigmentation has started, repigmentation. And you can see third follow-up, blackness, the pigmentation has come to a very great level. Fourth follow-up, you can see, this is 2022 case, and you can see first, second, third, and fourth. Consecutive follow-up photographs is there in front of you, how the case has evolved and how the case has improved so well, right? So this is there in front, and how Natromure has, helped in this condition. Coming to another case, this child having vitiligo on the lower eyelid, right? You can see this is a very important case, and I just prescribed on the higher mental symptoms. I told you, if you get the exact cause, ailment, if you get the higher mental symptoms, nothing like it, right? Higher mental symptoms are very important in taking a case. And in this, we had a consecutive, symptoms of dreams of unsuccessful efforts. She wants to do something, but she cannot do. She is catching a train, but she is missing the train. She is writing an exam, but her time is over. The examiner is taking her, answer sheet. So she's trying to do something, but she's not able to do. Dreams of unsuccessful effort. वो कुछ करना चाहती है लेकिन नहीं कर पा रही है, right? This is important. Delusion, someone standing behind. कोई उसके पीछे खड़ा है. She always checks. Somebody is behind her. Somebody is behind her. Fear of snakes and fear of examination. Only higher mental symptoms were, given importance in this case. And calcarea carb was given in this case. Repertorization was done. Single dose. Second follow-up, you can see pigmentation has all improved so well. And you can see before and after photographs, pigmentation has totally come down. This patient has really improved very well. Another case coming. Just see the condition of the case. So many white patches on the various parts of the face. And I want to tell you that every case improves. Some cases improve to like 60%, 70%, and certain cases improve 100%, right? So there are mixed kind of, results are there in vitiligo. Not every case improves to 100%, right? In some cases we are successful by 60%, 70%. In some cases we do. In few cases we don't. The medicine doesn't respond also. Okay, that is also there. So I want to show you this case, 17-year-old male student, and you can see the white patches on his face. And it's a long history, fear of snakes, delusion of snakes. And once this patient was coming back from the school, and he had an encounter of snakes, and that continued for very long. And although this child is very confused, lazy, poor in studies, poor in mathematics, and various things were there, and fears were prominent: delusion of snakes, fear of snakes, and lazy. And this case improved very well, just taking the higher mental symptoms, ailments from fright, delusion, snakes in and around him, fear of snakes, and dreams of snakes. Just important higher mental symptoms were taken in this case. The fright was there in his mind, which continued for very long period. See, if you come across fears of come across snakes, you'll have fear for like 1 month, 2 months, 6 months. But this boy had it for very long time, and he was also having along with it a delusion and fear and dreams. So in this case, repertorization was done, and because the confusion and various things were there in this case, and the patient improved, and simple calcarea carb was given in this case. And I tell you one thing: whenever we think of snakes, we always think about Ophidia group. But no, you have to see the constitution of the patient. So constitution, because the patient was poor in studies, confused, you can see lazy, inattentive, poor in mathematics, and these things were there, along with dreams, fear, delusion. And repertorization was done, calcarea carb was given, and you can see how calcarea carb, so many spots have started improving, right? You just see the third follow-up of this patient. Most of the spots have improved, most of the spots, but lips has not improved so much. Okay, so just see before and after graph. All the spots have improved, but only lips part has not improved that much. But lips have also improved. You can see the pigmentation is there on the lower lip. Black spots have started coming up, but most of the even the on the lower eyelid, on the upper lip, on the nose, everything has improved, right? So this case is very important to show. I have another case I want to share. Young boy, 10 years old, big patch on his temples, big patch, white patch. And you can see discoloration around left cheek and temples. And rubrics were mild, yielding, consolation, amulate, sensitive, desire of mental, anxious, fear of alone, fear of close places, claustrophobia, and weeps easily. Claustrophobia cannot be in the closed places. बंद जगह वो नहीं रह सकता था. Or he was very mild, sensitive, emotional, consolation, amulate, fearful also, fear of alone, and weeps easily. Simple rubrics were taken, and repertorization was done. You can see how beautifully pulsatilla 30 was given in this case. Pulsatilla 30 potency, and you can see how beautifully in second follow-up the pigmentation has mostly improved, and presently there is not a single patch, even there is no evidence of white patch also. So how beautifully vitiligo has cured in this case. Now coming to one more case, just see a young boy having vitiligo on both the sides, on both the temples. Okay, this is important to understand that vitiligo generally, I have an experience that vitiligo which is there in the children's of below like 13 years, they improve very well if we give constitutional medicines. So I have come across many children who have improved very well with homeopathy in vitiligo cases. So this is also one of those. And you can see confusion of mind, lazy, mathematics inapt for, sympathetic, very important, sympathetic, artistic, emotional, desire cold food, consolation, amulet, and desire to travel. This is very important to understand, right? And it has a mix of calcarea element and artistic, sympathetic, desire cold food, drinks of FOS element is also there, right? So rubrics were taken and calcarea FOS 30 was given in this case because clear-cut calcarea element and FOS element was there. So first thing, one thing I want to tell you, that because we are getting two different, we can't mix two things, like calcarea FOS cannot be given like that. Proper repertorization was done, then only it was given. Okay, so in this case, there was a constitution of calcarea plus even phosphorus. So calcarea FOS was given first. Second is calcarea FOS is very below in this repertorization chart. But let me tell you one thing. Repertory is only suggestive. Repertory is not the final court of justice. Final court of justice is materia medica. Repertory can only suggest you 10 medicines. But knowledge of materia medica has to be applied, then only to find out which constitutional medicine the patient belongs to. That is important. Okay. So it's not that whatever the medicine has come in the repertorization on the first two medicines or first three medicines, only that has to be given. No, the proper constitution has to be taken, considered, and then only that medicine has to be given, right? In this case, and you can see calcarea FOS was given after repertorization, and you can see the result in front of you. You can see pigmentation has improved before and after photograph. Okay? There are so many good cases which I have seen of this. This is a very important case I want to show you. Very young, 9-month-old child, and just see the pigmentation. I want to show you that if such a young patient, just nine months old, right? And you can see the pigmentation on temples, on the eyelids, on the forehead. You can see the pigment. Just observe carefully what discoloration is around the left eye, upper cheek, temples, nose, ears. These are there. This is a very important case because at this point of time, if you are not giving him the right medicine, this case will go out of hand. And if you get the right medicine at this point of time, this case will improve very well. So I want to tell you how this case I have just brought to tell you this is a make or break case. आप इसको अगर सही दवा देंगे तो आप ठीक हो जाएगा, और अगर आप अभी दवा नहीं सही पड़ेगी तो ये बिल्कुल हाथ से बढ़ जाएगा और ये फैल जाएगा. So this is very important to understand such young patients. And you can see affectionate, sympathetic, company desire for, sentimental, consolation amulet, better cold food and drinks, delicate eyelashes. There was very less, just 9-month-old child. What mentals you will get? You can only get whatever the mother says, whatever the father says. It is your observation that is important. So what important I gave to this was his delicate eyelashes. I gave importance to the delicate eyelashes. Second, he was very affectionate, sympathetic, desire to be carried, company desire for, sentimental, weeps, and consolation amulet, desire and better, and desire cold food and cold drinks, and delicate eyelashes, just because of the nature of the child and whatever I could gather from mother and father. I gave the child phosphorus 30 dose, and you can see first follow all the pigmentations and improve. अगर यहाँ पे गलत दवा पड़ती तो ये केस हाथ से निकल जाता. That is what I'm telling you. These cases are very important to understand. And before and after, you can see not even a single patch of the white spot is there. So it's a make or break case. So this is what I want to tell you, that how homeopathy works very well. And just see this case. Another case of white patches, okay, on the upper lip, on the cheeks, and so many places around mouth. And this female, very poor female, coming from a rural background, and a lot of mentals were there in this case. After her father's death, these cases, she started having white patches. There was a prolonged grief and very irritable nature, emotional, all these things were there. Ailment from death of loved one, grief, sentimental, music sensitive to, company aversion, and anger, talks and dispose. These were prime things. and comes with anger consoled, consolation ameliorate, right? Aggravate, consolation aggravate, and dwells on past disagreeable occurrences. These were the important rubrics. Repertorization was done in this case, and you can see natrum mur was given in this case. Natrum mur 1M1 was given in this case, and you can see in the first follow-up, this is the first follow-up. Second follow-up, you can see the whiteness has come down, the pigmentation has started coming up, blackness is coming, and the white spots from the margins has started coming, receding, started receding. The spots have started reducing. You can see in the second follow. And just see the third follow. The upper lip is totally fine. Upper lips is there. Lips are clear. This has also improved. So various spots have improved. Even, pigmentation has started coming up, with blackness has started, coming, and whiteness has started, the area of white patch has started reducing. That has started reducing. So this is the third follow-up. This is the fourth follow-up. You can see how beautifully more than 70% this case has improved. And presently, I don't have the latest photograph of this patient. This patient has improved totally. She's totally fine, right, at this point of time. So I want to show you one more case. A young child, you can see white patch on the upper lip, and you can see how it is extending to the lower margins. Rubrics: timidity, consolation amulette, claustrophobia, yielding, selfish, thirstless behavior, attention-seeking behavior was then there in this case. Attention-seeking behavior, and she used to weep easily, very claustrophobic. She always wanted to be in the open air. Repertorization was done in this case, and you can see pulsatilla. See, just small, young child. You just can't get a lot of mentals. You just can't get mental. You have to observe and ask the parent what kind of the nature of the patient is. And pulsatilla 30 was given, and you can see pigmentation has started coming up. Spots have started coming up in first follow. This is the second follow. You can see the improvement. And third follow, mostly only this part, a little part of the margins of the upper lip, white spots are left. And after that, you can see how beautifully the patient has improved. This is how the pigmentation of such a small child, she has improved to she being totally fine. So this is the importance of homeopathy. I want to tell you few clinical points I want to tell you about autoimmune diseases. Koebner phenomena is very important in vitiligo, psoriasis, lichen planus. You have to tell to the patient that if there is injury can be mechanical, chemical, or friction. Friction can be there. Chemical injury can be there. So to avoid friction, avoid injury, that is Koebner phenomena, has to be explained to all the patients. And that is, if you're allergic to certain irritants, some patients are allergic to hair color, some are allergic to the lipsticks, some are allergic to the rubber of the of the slippers. There you can be allergic to anything, right? You can allergic to the sun, and more often than not, you will come across patients. Doctor, I had this injury and then I started a white patch. This is a very common thing. So everyone has to, a doctor has a duty to explain it to the patient that every patient should avoid friction, injury. It can be mechanical, it can be chemical, it can be like, from the sun, anything. Any allergy should be avoided. That is Koebner phenomena, has to be explained properly. So I just want to tell you in my presentation that how beautifully homeopathy can help in various cases of vitiligo. And I hope I've shown you enough cases. I have got a lot of cases, even the published cases of vitiligo, but time is less. Only this I could pack in 1 hour. And I hope in the next time I'll show you many more cases. I have a full around 1,000 case studies of vitiligo. And I just want to share few things. A few motivational lines I want to tell you to all my brothers, homeopathic brothers and students and doctors. Surround yourself with people whose eyes light up when they see you coming. Slow is the fastest way to get to where you want to be. And top of one mountain is the bottom of the next. So keep climbing. So keep working hard for homeopathy. You will get the success. And most important, anyone can dream it. Show the world that you can do it. That is the way, that is the mark that we have to create for homeopathy. Thank you very much. Thank you, IFPH, for this opportunity. I hope in many more sessions I'll share more cases of various diseases, various disorders. And thank you, Sahani sir, Dr. Dhanesh sir, for this opportunity. Thank you very much for patiently listening.
Thank you, Dr. Nishant Srivastava. Really a rocking performance from you. This is the way to celebrate homeopathy. That's what I can say in a single word. The celebration of homeopathy. This is what you have given to this platform, and the ways and means by which your selection of medicine is really the classical way, and that works at all time. That's the beauty of homeopathy. And congratulations. Hope we can have some more sessions on the same subject. In this case, in all these cases, you never go for any rare remedy, but you stick on to the constitutional remedy, and that really give you wonderful results in this session. And hope we can have some more presentations also. And only 3 minutes remaining. If somebody want to have a chat or want to communicate with Dr. Nishant Srivastava, you can raise your hand so that we will allow you to have a discussion to Dr. Yes, Guru Viren, please. 1 minute, just 1 minute. Yes, Dr. Guru Viren. Please unmute. Please unmute, Dr. Gurgiran.
Yes, sir. Yes, sir. Sir,
Yes.
it was a wonderful cases presentation, sir, what you have done. And I want to ask one thing, sir, that in vitiligo cases, only the constitutional medicine helps, or is there any straight remedy like that, or any, if there is a case of paucity, in some of the cases, we experience some paucity in cases. So in that case, can we use some blockbusters like no sort, sarcodes, anything like that?
Definitely.
Don't ask those.
Yes. When there is miasmatic blockage, to be specific, your question is very good. Whenever the case stalls, whenever case is not responding, the case has improved, but after some particular time, it has stopped showing response. Miasmatic blockage has to be removed by nosodes, and like sorinum, and even when you are ending the treatment, even then also you can give a higher potency nosode for the locking the disease, that it should not come back. Recurrence is also important. You have to for the paucity of the case, you can give nosode, and even for the recurrence to stop, then also you can give nosode, right? So it's a very good question, and this was the only point maybe I was missing. So it's very good that you asked. Very nice. Thank you. Yes.
It's over to Dr. Hibat.
Hello, doctor. Very nice. What I want to say, because I am after every cases you taught, you are more given more importance to general medicine, general symptoms, isn't it? General,
Yes.
not
Yes,
going to
Doctor,
going to particular symptoms.
It's not audible, I think.
He was asking whether you have given more importance to physical generals rather than the mental.
Somebody.
Both.
Physical general.
Both. According to the case. See, mentals has to be taken and should be backed up by right physical generals also, as I explained in all the cases. Physical generals are very important. They are milestones. They will guide you towards the constitutional medicine, right? But mentals are always risky, right? Your interpretation of mind will be different. My interpretation of mind will be different. I'll take some other rubric, you will take some other rubric, right? There can be the difference. But physical generals, if desired sweet is there, it will be sweet for you also, for me also. If it is chili, then it is chili for you also, chili for me also. If it is right-sided, it's right-sided for you also, right-sided for me also. That we can't change, right? That is a milestone. So physical journals are equally important, which should be backed up by the mental symptoms, especially if we get ailment factor, cause is if we get a cause, or a proper constitution, higher mental symptoms, dreams, delusion, fears. This is also very important. And the moreover, the constitution of the patient, that is very important. So everything
you,
has
sir.
to be considered.
Thank you.
Now I invite Dr. Bhavesh Shah to have a question. Dr. You can unmute yourself.
Hello.
Yes.
Thank you, doctor, for very nice session. I want to ask about the potency and repetition.
Potency generally, I
You are
start.
in some cases you give some 30 potency phosphorus,
Yes.
like
Yes.
in some you give natramure 1M.
Yes.
Hmm.
Yes.
Usually in a young child, we usually give in higher potency. In some
Yes.
cases, you please explain, sir.
Yeah, my clinical experience is there. See, everybody has its own clinical experience, but more often than not, I have always experienced, if in the cases of children's, if it's a very young child, if we in certain cases of vitiligo, young children, if we have started with 1,000 potencies, in some cases they have backfired also. They have also backfired. So in some cases, they have improved also. So I want to tell you that playing it safe is always better. First. Second, 30 potency has less aggravation. This is what my clinical experience is. I'm talking about my clinical experience. Your can be different. Anybody can be different. But I'm telling you my observation.
Okay, sir.
30 potency is safer.
Okay.
And you can step up also from 30 to 200 to 1M. Like that, you have a long, playing field also. First. Second, I want to tell you that higher potencies are like double-edged swords. They are like double-edged swords. If you cut it, you'll get the great result, and if you don't get it, it can backfire also. So it's better to be safe, because we are dealing with young children. The parents are very anxious. They are very troubled with the white spots. So I will always adjust according to my clinical understanding. I have mostly started with 30. And if you have higher mental symptoms, you're confident about yourself, you can give 1M also.
Okay, sir. With that,
repetition, sir.
A single dose. I think start with a single dose, because aggravations are there. Start with single dose.
As our time is already finished, so tomorrow we will have a session from Dr. Survey Castillo from Chile.
Thank you, doctor.
And he will be presenting adding forces, a new strategy, homeopathy, and its relationship with the integrative medicine and therapies. So he is a dental surgeon practicing homeopathy. So wish you, I hope all of you will be there in this tomorrow at the same time. We will upload the videos of the presentation tomorrow itself, so that those who missed the session from the very beginning can watch again and again. You can also share it with your friends so that homeopathy will reach every family. This is the purpose of this kind of presentation, that we can show the world that homeopathy is the science which can cure the patient permanently. This is the beauty of Dr. Nishant Srivastava. So it is really, we all celebrating this session. Thank you, Dr. Nishant, once again. Thank you once again. Hope we can have some more presentation. Tomorrow, all of us can meet. You can also use the same link for tomorrow also. Thank you all. Good night.